Zepeto memiliki 200 juta pengguna di seluruh dunia, dan Rosie, manusia virtual, memiliki 100.000 followers dan banyak muncul di iklan-iklan perusahaan gitu.
디지털 뉴딜은 한국의 프로젝트지만 유엔의 지속 가능 목표를 지원하고 있습니다.
Jadi walaupun Digital New Deal adalah memang proyeknya Korea, tetapi tentunya tetap mendukung tujuan SDG Sustainable Goals-nya dari UN.
지속 가능한 소비와 생산, 불평등 해소, 산업 혁신, 인프라, 그리고 건강과 웰빙, 좋은 일자리와 경제 성장 등 다양한 목표를 달성하는 데 기여하고 있습니다.
Tentunya juga berkontribusi untuk mencapai berbagai tujuan seperti konsumsi dan produksi yang jangka panjang, kemudian menyelesaikan ketidaksetaraan, kemudian inovasi, industri, infrastruktur, dan juga tentunya memunculkan lapangan pekerjaan dan pertumbuhan ekonomi.
또한 다양한 프로젝트와 프로그램을 통해서 디지털 뉴딜을 통해서 얻은 경험하고 노하우를 공유하고자 노력하고 있습니다.
Kami juga terus berusaha untuk berbagi pengalaman dan pengetahuan yang kami peroleh melalui Digital New Deal, seperti melalui berbagai proyek dan program seperti ini.
오늘의 세미나도 그러한 과정의 일부로 보시면 좋을 것 같습니다.
Jadi saya juga berpikir seminar hari ini tuh adalah sesi yang bagus untuk dilihat sebagai bagian dari proses tersebut.
지금까지 한국의 디지털 뉴딜 정책에 대해서 말씀을 드렸습니다. 아무쪼록 도움이 되셨기를 기대하고 있습니다.
Jadi sampai sini saja saya sudah menerangkan tentang Digital New Deal dan saya harap ini bisa bermanfaat pada hadirin sekalian.
디지털 대전환이라는 거스를 수 없는 시대의 물결에서 새로운 미래를 만들어 나가는데 한국과 인도네시아가 든든한 파트너로 협력하기를 바랍니다.
Jadi saya berharap juga Korea dan Indonesia akan terus bekerja sama dan sebagai mitra yang kuat dalam menciptakan masa depan baru dalam transisi digital.
들어주셔서 감사합니다. Terima kasih.
Ya, terima kasih atas perhatiannya.
Terima kasih kepada Misteri atas waktu dan pemaparannya. Bapak dan Ibu yang kami hormati, sebelumnya saya akan menyampaikan jika memang Bapak dan Ibu sekalian memiliki pertanyaan untuk para pemateri, pertanyaan dapat dituliskan di kolom chat dan nanti akan tim kami inventarisir dan akan dijawab pada akhir sesi pertama nanti. Selanjutnya, marilah kita dengarkan materi kedua pada sesi satu ini, yaitu informasi pelayanan publik yang akan dipaparkan oleh Bapak Cahyono Tribirowo selaku Asisten Deputi Perumusan Kebijakan dan Koordinasi Penerapan SPBE. Kepada Bapak Cahyono, kami persilahkan.
Assalamualaikum warahmatullahi wabarakatuh. Selamat siang, salam sejahtera untuk kita semuanya. Terima kasih atas kesempatan yang sudah disampaikan. Ini sangat berharga terhadap apa yang sudah disampaikan oleh rekan-rekan dari Korea, apa yang sudah kita bisa pelajari hingga saat ini. Dan ini tentunya akan sangat membantu kita semua di Indonesia, di pemerintah Indonesia dalam melaksanakan transformasi digital. Ini izinkan kami untuk bisa sampaikan paparan. Oke, terima kasih. Jadi untuk pembahasan kali ini ingin saya sampaikan mengenai rencana dari pemerintah Indonesia untuk memastikan mengenai penerapan terhadap pelayanan publik, dan apa yang kita sampaikan di sini mungkin juga bagian apa yang kita coba sudah pelajari dari pemerintah di Korea mengenai perubahan layanan publik yang sesuai dengan kerangka layanan digital nasional, di mana sesuai dengan arahan Bapak Presiden bahwa pelayanan publik ini menjadi hal yang sangat penting di kita, masyarakat, di mana ini menjadi suatu wajah pemerintah dalam memberikan layanan kepada masyarakat. Dan begitu juga bahwa apa yang kita sampaikan kepada masyarakat ini adalah menjadi suatu perubahan yang sangat dirasakan, dan tentunya itu akan mendapatkan manfaat lebih apabila kita menerapkan menerapkan teknologi digital, sehingga visi Bapak Presiden bahwa kita akan menyiapkan digital melayani atau DILAN dalam pelaksanaan penyediaan layanan pemerintah kepada masyarakat. Nah, hal tersebut maka kita memiliki pertimbangan dalam pelaksanaan penyediaan layanan pemerintah. Yang pertama adalah terkait dengan bagaimana memastikan layanan pemerintah itu dapat dirasakan oleh semua masyarakat di semua tingkatan masyarakat. Kemudian aksesibilitas itu bisa menjadi hal yang penting, baik itu perbedaan dari daerah Jawa, di luar Jawa, daerah Barat dan Timur, maka kita akan memastikan layanan pemerintah itu bisa diakses oleh semua wilayah. Yang kedua adalah memastikan keterpaduan layanan di tingkat nasional. Ya, mungkin juga Bapak Ibu semua sudah perhatikan bahwa apa yang dicapai oleh Korea ini akan memastikan bahwa layanan terpadu tidak hanya itu di masing-masing sektor, tapi layanan terpadu lintas sektor. Selanjutnya juga bahwa layanan itu akan memastikan terhadap standarnya apa yang diberikan melalui layanan di daerah timur, di daerah barat, itu kan sangat erat kaitannya dengan memastikan layanan sesuai dengan standar. Dan selanjutnya, yang tadi juga sudah disampaikan bahwa pelaksanaannya akan memastikan dengan penerapan teknologi dan penerapan teknologi berbasis digital. Dalam kerangka transformasi digital inilah yang kita bisa selanjutnya mengikuti pola dalam kerangka regulasi dari sistem pemerintahan berbasis elektronik atau e-government, dan juga kerangka regulasi satu data Indonesia dalam rangka kita mewujudkan data driven government. Selanjutnya dari keinginan untuk mewujudkan hal tersebut, maka tentunya kita akan memiliki banyak hambatan, dan pertama yang sangat tinggi adalah
Pak
ya.
Yun, mohon maaf sebentar Pak. Ini kan kebetulan dari tim DJCC juga minta untuk di-translate kan ke dalam bahasa Korea nih. Jadi saya bisa masuk potongannya di sebelah mana nanti ya Pak ya?
Oke, siap.
Ini mau di-translate dulu aja Kak atau gimana Pak?
Oke, silakan di-translate dulu aja.
일단 차이언 국장님의 그 국가 디지털 서비스 프레임워크에서 공공 서비스 전환에 대해서 발표를 했습니다. 지금 정부 서비스, 특히 공공 서비스 및 퍼블릭 서비스 몰 그리고 디지털 퍼블릭 서비스 몰의 수립을 정의하기 위해 다음과 같이 조코위 대통령이 비전 및 방향을 가지고 있습니다. 공공 서비스는 국민의 일상생활에서 국가의 위태로움을 구체적으로 보여주는 얼굴이고, 거버넌스 영역에서는 디지털로 서비스를 제공하는 정부가 필요하다고 생각합니다. 그리고 조코위의 대통령의 방향을 잘 구현하기 위해 다음과 같이 고려를 하고 있습니다. 첫 번째는 서비스의 포괄성 및 저급성에 대해서 모든 국민들이 공공 서비스를 쉽게 서비스 받을 수 있으며 언제 어디서나 접근 가능한 것을 보장합니다. 그리고 전국적으로 종합 서비스에 대해서는 현재는 영역 간의 비즈니스 프로세스가 정의되기 시작하며 그 다음에 주제별 정부 서비스도 정의하게 될 겁니다. 그래서 각 중앙기관 및 지방정부가 구축한 많은 서비스 채널로 인해 국민들이 더 이상 헷갈리지 않을 겁니다. 세 번째는 국가 서비스 표준. 통합적인 주제별 정보 서비스가 수립되므로 국가적으로 표준된 서비스 레벨 어그리먼트의 품질이 필요합니다. 마지막으로 디지털 전환에 대해서는 물론 1, 2, 3, 4번의 고려사항에 대해서 SPBE와 SDI의 프레임워크에서 수행할 수 있는 전제 기반하는 서비스 또는 디지털 서비스를 구현합니다. Ya, boleh dilanjutkan, Pak.
Ya, terima kasih. Dan mungkin satu persatu tantangan yang kita perlu hadapi. Pertama adalah banyaknya ketimpangan kemampuan terhadap aksesibilitas layanan, dan itu juga terjadi di kita, baik itu di daerah barat dan timur, tapi juga yang sangat ekstrim adalah dari Jawa dan di luar Jawa.
위 과제를 구현하는 데에 물론 많은 어려움이 있을 거라고 생각합니다. 첫 번째는 사회 역량의 격차입니다. 자바섬과 자바섬의 서부 및 동부 지역, 그리고 도시와 마을 지역 사이의 국민 역량 격차는 모든 당사자가 활용할 수 있는 공공 서비스를 정의합니다. Ya, Pak.
Selanjutnya yang kedua adalah keterbatasan sumber daya, di mana hal ini kita perlu lakukan dengan melalui konsolidasi, kolaborasi dari semua instansi untuk memastikan sumber daya yang ada di masing-masing instansi, baik pusat dan daerah, ini bisa berkolaborasi untuk membentuk layanan terpadu.
두 번째로는 제한된 자원입니다. 전국적으로 통합된 공공 서비스를 구축하는데 인력, 역량, 재정적 가용성 포함한 많은 것을 필요하므로 실제로 제한된 자원이 있습니다. 그래서 이러한 거는 국가 차원에서 공급할 수 있게 합니다.
Selanjutnya yang ketiga, ini juga hal yang sama yang terjadi di Korea, di mana literasi digital juga masih banyak ketimpangan di Indonesia, dan kita sudah mulai melakukan dengan banyak pelatihan-pelatihan terhadap penerapan teknologi digital, pemahaman terhadap pemanfaatan layanan digital, dan kita juga lakukan tidak hanya itu untuk ASN tapi juga untuk lingkup masyarakat secara luas.
마지막으로 디지털 리터러시입니다. 인도네시아는 국민이 매우 다양하고 모든 국민들이 디지털 리터러시에 대한 힘을 가지고 있는 것이 아니기 때문에 먼저 영역 강화 필요하고 서비스는 모든 것을 디지털화하기뿐만 아니라 기존에 있는 공공 서비스에 보완하는 것을 정의 필요합니다.
Selanjutnya, maka apa yang tadi kita sampaikan mengenai visi dari pimpinan negara dan apa saja yang kita bisa lakukan untuk bisa memastikan dalam penyediaan layanan pemerintah yang terpadu, maka kita selanjutnya mulai memastikan mengenai keterpaduan antar kelembagaan.
일단은 그래서 따라서 양호 필요한 것은 첫 번째는 대통령의 방향 그리고 RPGM을 해석하고 구현하기 위한 통합 기관이 필요합니다.
Sehingga arahan Bapak Presiden melalui 5 arahan Presiden dan kemudian 7 agenda pembangunan yang di sebelah kiri, ini kan menjadi layanan pemerintah yang terpadu melalui tematik layanan pemerintah.
여기서 보여준 슬라이드에서는 주주별 통합 공공 서비스 형태로 구현하며 G2C 서비스 형태로 최소 노동과 관련 법률에 대한 대응 같은 기본적 또는 전략적인 이슈에 우선순위를 둡니다.
Langkah yang awal yang kita lakukan adalah mulai memastikan digitalisasi proses bisnis internal pemerintah, dan itu akan melalui kerangka regulasi SPBI.
SPB의 규정을 통해서 어려움에 대해서는 극복하도록 하겠습니다.
Dan selanjutnya dari tersedianya layanan proses bisnis pemerintah yang terintegrasi, ini akan menghasilkan integrasi layanan kepada masyarakat melalui tematik layanan yang sudah kita definisikan dalam arsitektur SPBE nasional.
그 주제별 통합 공공 서비스 형태로 기원하며 G2C 서비스 형태로 그 국민들에게 서비스를 제공하는 걸 합니다.
Dalam arsitektur SPBE nasional, kita mengutamakan ada dua area untuk penyediaan layanan masyarakat. Yang pertama adalah layanan kepada masyarakat, dan kedua layanan kepada dunia usaha.
그 아시텍tur SPB를 따르면 두 가지 영역에 있고, 그 첫 번째는 국민을 위한 서비스이고, 그리고 두 번째는 비즈니스를 위한 서비스입니다.
Layanan kepada masyarakat secara langsung, ini salah satu contohnya yang ada di dalam tampilan adalah layanan kesehatan terpadu, layanan pendidikan, dan layanan sosial, dan juga layanan terkait dengan ketertiban dan keamanan.
지금 본 슬라이드를 따르면 거기 국민을 위한 서비스를 거기 government to citizen에 있는 목록이 있습니다. 그리고 그 건강 서비스 그리고 교육 서비스 등.
Dan selanjutnya untuk layanan kepada dunia usaha, kita mengutamakan untuk bisa mencapai indeks pencapaian easy of doing business, terutama untuk layanan perizinan berusaha dan juga layanan monitoring pembangunan pekerjaan umum dan perumahan rakyat.
그리고 government to business에 대해서는 그 비즈니스에 대한 허가, 그리고 두 번째는 public working and housing development에 대한 서비스를 제공하도록 하겠습니다.
Dari kerangka tersebut, maka kita sudah mulai melaksanakan penerapan SPBE secara terpadu, sehingga sistem-sistem yang sudah ada, sudah berjalan, yang memiliki fungsi yang sejenis atau serupa, sudah mulai diintegrasikan ke dalam satu platform digital.
포괄적인 공공 서비스에 정의한 곳으로 그 맨 위에 있는 통합 디지털 플랫폼으로 통합된 공공 서비스에 대해서는 지금 구축하고 있습니다.
Layanan digital yang terpadu di tingkat nasional tersebut itu akan menjadi salah satu konten dalam pelayanan publik, sehingga yang saat ini sudah terjadi dengan mall pelayanan publik akan memiliki sistem informasi yang terintegrasi.
통합되고 분산된 공공 서비스 정보 시스템을 갖춘 지금 퍼블릭 서비스 몰이 있습니다.
Sehingga mall pelayanan publik yang ada ini akan memiliki sistem informasi yang terintegrasi dan mendekat kepada masyarakat melalui integrated public service (IPS).
아까 포괄적인 공공 서비스에 정의한 그 퍼블릭 서비스에 지금 그 국민에 다가가서 국민들에게 쉽게 서비스를
Untuk memastikan inklusivitas layanan, maka masyarakat dapat hadir secara fisik untuk mendapatkan berbagai macam tematik layanan yang telah kita definisikan melalui portal layanan digital nasional dengan memiliki standar nasional.
국민이 국가 서비스 표준으로 국가 디지털 서비스 포털을 통해서 다양한 주제별 서비스를 받기 위해 직접적으로 그 사무실에 방문할 수 있게 합니다.
Dan sentra-sentra layanan tersebut itu tidak hanya terjadi di perkotaan, tapi juga disiapkan di rural area maupun di remote area. dan tentunya memiliki perbedaan klaster layanan, kelompok layanan dari ketiga hal tersebut.
퍼블릭 뭐 서비스에 대해서는 큰 도시에만 제공하는 것만 아니라 작은 도시 그리고 진짜 그 서비스를 그 서비스를 받기 어려운 지역에서도 제공할 겁니다.
Dan juga dilakukan penyediaan layanan di area-area yang memang menjadi tempat berkumpulnya masyarakat atau tempat aktivitas masyarakat berlangsung.
그리고 많은 사람들이 같이 모이고 활동을 하고 있는 그 장소에서도 이런 센터가 제공하도록 합니다.
Maka apa yang kita harapkan tadi, yang sudah kita rencanakan, ini yang kita mulai rancang melalui penerapan arsitektur SPBE sebagaimana ilustrasi dalam gambar ini.
그 SPB의 규정 프레임워크의 SPB 아키텍처 활용 형태에서 국가 디지털 서비스로 한 통합적인 비즈니스 프로세스 정의에 기초한 통합 공고 서비스 정보 시스템을 그림과 같이 구성할 수 있습니다.
Setiap komponen dalam domain arsitektur memiliki area kewenangan yang diampu oleh setiap instansi. Sebagai contoh, untuk proses bisnis akan dikelola dan ditetapkan oleh Kementerian Pan-RB dan juga untuk domain layanan.
국가 차원에서 다양한 기관들이 지원할 겁니다. 즉, 애플리케이션 기술, ICT 인프라 조달 영역에서는 커민포에서 통합적인 정보보안 영역에서는 그리고 통합적인 정보보안 영역에서는 BECCN의 국가 암원기관에서 그리고 또한 데이터 및 정보 영역에서는 거기 원데이터 인도네시아에서 제공할 겁니다.
Khusus untuk lingkup dari Kementerian Pan-RB, maka kita akan memastikan terutama untuk lintas proses bisnis antar lintas sektor yang menghasilkan tematik layanan publik.
그 한편으로 맨판 역할은 첫 번째는 주조별 공공 서비스를 정의하기 위해 영역 간의 통합 정부 비즈니스 프로세스를 교육 그리고 수립하는 겁니다.
Dan juga Kementerian Pan-RB akan memastikan dalam penetapan standarisasi pelayanan publik yang dimananya yang standar tersebut akan menjadi acuan untuk instansi pusat dan pemerintah daerah dalam penerapan layanan digital yang terintegrasi.
그리고 두 번째는 중앙기관 및 지방정부가 통합 서비스를 구현하기에 참조로 된 공공서비스의 보존화를 수립하는 겁니다.
Sistem informasi pelayanan publik yang kami kembangkan di Kementerian PNRB ini bisa menjadi embrio dalam pembentukan layanan digital nasional yang akan menjadi bagian dari layanan publik pemerintah.
공공서비스 시스템이 정보 통합 공공서비스 일부인 국가 디지털 서비스를 구축하기에 시드가 될 수 있도록 합니다.
Terima kasih atas kesempatan yang disampaikan. Mudah-mudahan apa yang kami sampaikan ini juga memiliki keselarasan mengenai sukses yang sudah diterapkan di Korea.
네, 제 발표는 여기까지 마치겠습니다. 도움이 될 수 있도록 기원합니다. 감사합니다.
Terima kasih.
Terima kasih banyak atas pemaparan dan waktunya Pak Iwan. Selanjutnya kita akan membuka sesi tanya jawab untuk sesi 1 kita kali ini. Silahkan Mbak Desti untuk pertanyaannya.
네, 첫 번째 질문이 들어왔습니다. 이 교육팀장님을 위한 질문인데요. 네, 방금 메타버스 이야기 많이 나오는데 메타버스 자체가 정확히 무엇인지 궁금하다고 합니다. 네, 그리고 두 번째 질문은 네, 2025년 메타버스 시장이 300조 원으로 성장할 거라는 것을 설명드렸는데, 그래서 이러한 예상과 기대가 어디에서 나오는지 네, 궁금하다고 합니다.
네. 일단 이제 메타버스 의미 자체가 이제 메타라는 게 이제 가상이라는 의미고, 버스는 이제 유니버스, 우주에서 왔다고 보시면 될 것 같습니다.
Nah, jadi metaverse itu sebenarnya artinya meta itu virtual ya, dan verse itu universe atau dunia, jadi dunia virtual.
아시겠지만 이제 그 페이스북도 이름을 이제 메타로 이름을 바꾸고 각국에 있는 세계 유사한 기업들이 이제 메타버스, 메타와 관련된 일을 하려고 많이 노력하고 있는 걸로 알고 있습니다.
Ya, seperti contohnya saat ini Facebook juga mengubah nama mereka menjadi Meta, dan juga perusahaan-perusahaan IT besar di setiap negara sekarang mulai itu memasuki pasar metaverse.
근데 사실 메타버스라는 개념이 이제 이전부터 있었다고 보시면 될 것 같은데, 인공 그 버추얼 리얼리티하고 오그멘티드 리얼리티, 가상현실이랑 증강현실이 이제 메타버스로 좀 통합이 된 거라고 보시면 될 것 같습니다.
Jadi sebenarnya metaverse yang kita ketahui itu sudah lama ada ya. Jadi bisa dilihat contohnya seperti augmented reality atau virtual reality itu masuk ke dalam situ.
아마 이제 이게 5G 네트워크가 이제 많이 깔리기 시작하면서 기존에 이제 있던 뭐 LTE라든지 4G 네트워크랑 달라진 차이점을 이제 찾으려고 하다 보니까 5G 네트워크가 가지는 특장점이 있는데, 예를 들면 초지연성이라고 해서 이제 지연이 아주 적게 되고 있고 속도가 빠르고, 이런 것들을 잘 할 수 있는 아이템, 컨텐츠가 뭐가 있을까 찾으면서 이런 메타버스가 좀 더 많이 활발하게 논의가 되고 있는 것 같습니다.
Jadi ini kalau disambungkan dengan berkembangnya 5G, sebelumnya kan 4G atau LTE itu internet sudah cukup cepat ya, tapi dengan 5G itu nanti internet semakin cepat lagi. Tapi semakin cepat lagi ini nantinya mengarah kemana? Jadi mengarah dengan memudahkan orang-orang untuk yaitu menggunakan metaverse gitu.
그래서 한국에서도 보면 이제 KT, 코리아텔레콤, 그리고 SK텔레콤 같은 통신사 주대로 이런 메타버스와 관련된 여러 가지 사업을 많이 하고 있고 주도권을 잡으려고 많이 노력하고 있습니다.
Jadi di Korea sendiri saat ini perusahaan telekomunikasi seperti KT namanya dan juga ada SKT, mereka dua-duanya juga sudah mulai memasuki pasar dan mengembangkan metaverse.
네. 아까 이제 나왔던 300조라는 거는 이제 그 전 세계 시장 규모라고 보시면 될 것 같고요. 지금 현재 뭐 시장 조사 업체에 따라서 다르긴 한데 한 51조 정도라고 보고 있는데, 이게 한 2025년에는 6배 정도로 늘어날 걸로 지금 보고 있는 것 같습니다.
Jadi perbaikan untuk yang 300 triliun won itu sendiri untuk di seluruh dunia ya. Kalau misalnya di Korea mungkin sekitar 50 triliun perkiraannya.
작년에 이제 저희가 디지털 뉴딜 2.0을 이제 발표하면서 메타버스와 관련된 여러 가지 이제 기업들도 좀 찾아보고 실제로 서비스가 뭐가 있을지 많이 한번 찾아보았습니다.
Ya, jadi mengapa tadi saya menjelaskan tentang metaverse itu karena melalui digital new deal ada inovasi-inovasi baru baik dari perusahaan swasta juga, dan salah satunya itu metaverse.
대표적인 기업이 버넥트라는 회사인데요. 이 버넥트라는 회사는 이제 AR, 그러니까 증강현실 기반으로 여러 가지 서비스를 만들어내고 있는데, 대표적인 예가 이제 스마트 글래스를 쓰고 실제 이제 공장에 있는 근로자하고 사무실에 있는 사람하고 서로 연결을 하면서 실제 공장에 관련된 고장이라든지 아니면 새로운 장비에 대한 설명이라든지 이런 것들을 실시간으로 하고 있습니다.
Jadi salah satu contohnya di Korea ada perusahaan namanya Bonect, Masenika,
버넥트.
Bonect. Dia ini memang ahlinya di bidang AI gitu, dan juga mereka memiliki teknologi seperti kacamata yang bisa melihat teknologi secara virtual. Jadi misalnya saat ini di pabriknya kalau saat menggunakan kacamata itu mereka bisa melihat pekerjaan di pabrik seperti ini saat apa, prosesnya bagaimana begitu secara langsung, dan juga maksudnya manajemen pabriknya seperti apa, begitu semua bisa dicek dengan teknologi kacamata mereka.
아까도 잠깐 설명드렸지만 제페토와 같은 이제 메타버스 또는 이제 이런 그 버추얼 이제 그런 서비스뿐만 아니라 기업들한테는 이제 그런 AR 그러니까 가상현실을 활용해 가지고 위험한 어떤 현장이라든지 아니면 다루기 힘든 여러 가지 아니면 멀리 떨어져 있는 환경에서도 서로 의사소통도 할 수 있고 실제로 가서 이제 공장에서 도와줄 수 있는 것처럼 많이 할 수 있을 겁니다. 이런 것들이 이제 아마 그 코로나 지금 비대면이 많이 중요되고 있는 상황에서 더 중요할 것 같습니다.
Dan juga seperti yang sudah saya jelaskan tadi, saya menyebutkan Zepeto, tapi selain itu juga banyak contoh-contoh yang mirip, tapi mungkin lebih berguna atau berfungsi di saat corona ini ya. Jadi setelah corona kan orang banyak yang remote working gitu. Jadi seperti contohnya tadi, sambil remote working, berkat augmented reality-nya mereka juga bisa saling manage walaupun dari jarak jauh, bisa melihat kondisi saat ini di pabriknya tuh seperti apa dengan jelas karena berkat teknologi itu.
이상입니다.
Ya, sekian dari saya.
Oke, baik. Pertanyaan selanjutnya Mbak Desti. Pertanyaan selanjutnya ini untuk Pak Ion. Mungkin bisa nanti ditranslatekan kembali ya Mbak Bunga ya dalam bahasa Arab. Are there any related regulation to facilitate the sharing and exchange of administrative information possessed by each institution? Pertanyaannya dari Jong Royon kepada Pak Syahyono, dipersilakan.
Ya, terima kasih. Gitu ya. Jadi untuk pertanyaan ini akan relasi dengan kerangka regulasi sistem pemerintahan berbasis elektronik SPBE dan kerangka regulasi Satu Data Indonesia atau SDI.
Jadi tadi Pak, jadi ada dua ya, yaitu regulasi terkait SPBE dan kerangka arsitektur SPBE ya?
Enggak, kerangka regulasi SPBE dan Satu Data Indonesia.
그래서 이 데이터 공유 그리고 교체하기 위한 관련된 규정은 두 가지 있습니다. 첫 번째는 그 SPBE 규정, 그리고 두 번째는 그 원데이터 인도네시아 규정으로 지금 규정하고 있습니다.
Di mana dalam kerangka regulasi SPBE, proses bisnis lintas sektor itu akan terkait dengan penyediaan layanan yang bersifat tematik kepada masyarakat dan juga untuk kebutuhan administrasi pemerintahan.
그 SPBE 규정에서는 그 기관 간의 비즈니스 프로세스에 그리고 국민에게 서비스 그리고 그 정부 행정 서비스에 대한 것을 규정하고 있습니다.
Di mana selanjutnya dalam memanfaatkan lintas proses bisnis tadi dalam bentuk kolaboratif government, maka tentunya akan didukung oleh penyediaan aplikasi dan database yang saling terkait.
그 기관 간의 비즈니스 프로세스를 서포트를 하기 위해서 어떤 애플리케이션 그리고 데이터베이스에 대해서는 지금 제공하고 있습니다.
Nah, dalam area untuk pembentukan database yang saling terintegrasi, maka di dalam kerangka regulasi Satu Data Indonesia diamanatkan untuk pembentukan portal data nasional.
그리고 종합된 데이터베이스를 구축하기 위해서 그 SDI, 그 원데이터 인도네시아를 통해 기반하는 그런 규정이 있고 그 데이터 센터를 구축하려고 합니다.
Untuk lingkup tadi penyediaan portal data nasional, maka akan sangat relasi kaitannya dengan memastikan dataset dan data referensi yang ditetapkan oleh masing-masing instansi dalam mempertukarkan data sesuai dengan kebutuhannya.
아까 죄송합니다. 그 데이터 센터가 아니라 그 국가 데이터 포털을 만들고 거기에서는 두 가지 데이터에 대해서는 정의를 해야 되고 첫 번째는 셋 데이터 세트 그리고 그 참조 데이터를 정의를 하고 있습니다.
Sehingga pertukaran data tersebut antar pemerintah atau antar instansi dapat terjadi dan tugas kegiatan tersebut akan dilaksanakan dalam forum satu data Indonesia.
그래서 그 기관의 데이터 교체를 할 수 있고 그 원 데이터 포럼에서도 이런 거에 대해서는 잘 논의하고 있습니다.
Ya, cukup. Terima kasih.
네, 이상입니다.
Baik, terima kasih Pak Ion. Mungkin ada pertanyaan selanjutnya Mbak Desti. Silakan. Oke, ini untuk misteri. Silakan Mbak Dia atau Mbak Bunga.
야, 네. 한국에서 공공 서비스 같은 경우도 혹시 메타버스 기술을 활용한 사례가 있는지 궁금하다고 합니다.
예. 작년에 이제 그 서울시에서 이제 메타버스 서울이라고 그래서 별도의 플랫폼을 만들고 서비스를 지금 많이 준비하고 있습니다.
Ya, tahun lalu juga di Seoul ada namanya Metaverse Seoul.
네, 대표적인 게 이제 메타버스 실제로 이제 활용했던 컨텐츠, 예를 들면 이제 서울에 많이 이제 오고 싶어 하시는데 서울에 이제 유명한 관광 명소를 이제 그 메타버스 뭐 아바타라든지 아니면 실감할 수 있는 컨텐츠로 만들어가지고 제공하려고 하고 있습니다.
Jadi mereka menyediakan servis berupa menunjukkan spot-spot, misalnya spot-spot turis yang terkenal di Korea ditunjukkan melalui metaverse begitu. Jadi orang bisa melihat dan merasakan langsung melalui metaverse.
그리고 실제 이제 그 시민들이 불편해하는 것들이 여러 가지 있을 텐데요. 그런 것들을 하는 콜센터가 있었습니다. 120 콜센터라고 있었는데 120 콜센터를 메타버스로 활용해가지고 아바타, AI 기반으로 해서 상담을 할 계획입니다.
Dan juga tentunya pasti banyak keluhan-keluhan kan dari masyarakat sehari-hari. Nah, untuk keluhan ini biasanya masyarakat menghubungi nomor 110 dan nomor 110 itu kemudian nanti yang melayani mereka adalah bagian dari metaverse seperti AI atau enggak avatar begitu.
그리고 이제 그 디지털 트윈이라 그래서 이제 실제 IoT 관련되는 센서들을 이제 각 도시의 여러 가지 장소에다가 설치를 하고 거기서 나온 데이터를 가지고 실제하고 똑같은 트윈, 가상세계, 가상현실을 만드는 건데요. 이런 디지털 트윈 기반의 도시 관리를 하려고 지금 계획을 하고 있는 걸로 알고 있습니다.
Dan juga ada yang namanya digital twin, ini dihubungkan ke IoT ya. Jadi ini akan diinstal di setiap kotanya dan juga jadi data-data yang di setiap kota itu terkoneksi semua begitu.
그리고 이제 아마 코로나 때문에 이제 많은 분들이 밖에서 나가서 활동하는 것들을 많이 못하기 때문에 집안에서 이제 여러 가지 활동을 하게 될 수밖에 없는데 그런 시민들이 이제 집에 있으면서 그런 자기만의 또 공간 또는 콘텐츠를 갖다 올려놓을 수 있는 시민 플랫폼도 별도로 만든다고 합니다.
Dan juga mungkin karena didorong karena situasi corona saat ini ya. Jadi orang-orang banyak yang stay at home di rumah saja dan juga maka dibuatlah platform di mana mereka bisa maksudnya berkumpul begitu secara online.
이상입니다.
Jadi segitu saja pada pertanyaan lain.
Terima kasih banyak, Misteri. Mungkin ada pertanyaan satu lagi nih, pertanyaan terakhir Mbak Desti, bisa next. Oke, dari Bapak atau Ibu, Miss atau Mrs. Miss, oke, Miss Song Hira. Oke, ini untuk Pak Cahyono. Does the current organization, including SPBE coordination team, have enough power to lead service integration using SPBE architecture as a governance tool? In Korea, there is a specialized agency, NIA, to support digital government organization? Does Indonesia have plan to establish or operate a specialized agency? Or do you have any plan to expand the existing organization? Silahkan Pak Iwan.
Ya, terima kasih Mbak Mutia. Ini terkait dengan kebutuhan kelembagaan untuk mendukung penerapan dari arsitektur SPBE. Maka karakteristik dari arsitektur kelembagaan di pemerintah Indonesia yang sudah saya sampaikan di paparan tadi, ini adalah bersifat kolaboratif government lintas sektor. Maka pelaksanaannya akan lebih sejalan dengan kita menerapkan dalam kerangka tim koordinasi SPBE nasional.
일단은 인도네시아에서는 이런 collaborative government 특징이 있고, 그래서 이런 그 역할에 대해서는 지금까지는 그 coordination 팀으로 하는 것은 지금 충분하다고 생각합니다.
Di mana di dalam tim koordinasi SPBE nasional itu akan memiliki kewenangan-kewenangan sesuai dengan lingkup tugas fungsinya, dan hal tersebut akan terkait dengan masing-masing domain atau masing-masing area di dalam arsitektur SPBE.
그래서 이 조정팀 안에서는 각각 업무 그리고 기능을 맡아서 그 각각 영역에서는 그런 업무를 하도록 합니다.
Dan tentunya setelah kita mempelajari apa yang sudah diterapkan contoh sukses di Korea, ini kan juga menjadi masukan ke dalam arsitektur kelembagaan di pemerintah Indonesia yang akan datang.
그래서 지금은 이 디지털을 통해서 그리고 한국 베스트 프랙티스들도 지금 다 보여주고, 네, kemudian Pak.
Ya, di mana contoh sukses yang ada di Korea saat ini dengan menggunakan kelembagaan yang secara khusus menangani transformasi digital bisa menjadi kajian dalam arsitektur kelembagaan di Indonesia selanjutnya.
그래서 그 베스트 프랙티스 사례를 보고 지금 한국에서는 그런 특정 기관이 있는 거는 앞으로 인도네시아의 거버넌스에 대해서는 뭐 그런 거에 대해서 다시 논의를 하도록 합니다.
Ya, cukup. Terima kasih.
네, 이상입니다.
Baik, terima kasih Pak Ian. Mungkin ini masih ada sedikit waktunya. Ini ada satu pertanyaan lagi Pak Ian di chatbox. Mungkin bisa kita jawab ya Pak Ian ya. Pertanyaannya dari Mr. or Mrs. Jong Royon. In order to provide service to the public, personal authentication must be prioritized. I'd like to know what are your plans for this?
Ya, terima kasih Mbak Mutia. Terkait dengan penyediaan pelayanan publik yang terintegrasi, tentunya akan menggunakan layanan autentikasi secara pribadi. Nah, hal ini juga sudah menjadi prioritas di kita, dan itu menjadi bagian dari layanan dasar pelayanan publik.
그럼 이번 그 통합 공공 서비스에 대해서는 이런 퍼스널 어텐티케이션에 대해서는 우리가 우선순위로 지금 과제로 생각하고 있습니다.
Layanan dasar tersebut akan berelasi dengan layanan kependudukan yang dikelola saat ini di Kementerian Dalam Negeri.
이런 퍼스널 어텐티케이션에 대해서는 기본 서비스로 들어가고 있고, 지금 거기 내무부에서도 이런 거에 대해서는 잘 관리하고 있습니다.
Dari kewenangan di Kementerian Dalam Negeri, maka mereka akan memastikan tersedianya nomor induk kependudukan untuk setiap warga negara yang nantinya akan bisa mengakses terhadap pelayanan publik berbasis digital.
그래서 내무부를 통해서 각 국민들이 주민등록번호를 가지고 그걸로 다양한 서비스를 잘 사용할 수 있게 만들겠습니다.
Dan kegiatan di dalam lingkup SPBE akan memiliki relasi terkait dengan penyiapan portal pelayanan publik secara nasional, di mana salah satu fiturnya adalah fungsi single sign-on yang akan merelasikan memanfaatkan database kependudukan tersebut.
그래서 SPB에서는 공공 서비스 포털을 준비하고 거기에서 싱글 사인온으로 모든 사람들이 서비스를 사용할 수 있게 만들고 있습니다.
Dan database kependudukan yang berbasis nomor induk kependudukan tersebut akan menjadi personal authentication untuk setiap warga negara.
아까 말씀드린 주민등록번호로 그걸로 그 사람마다 아까 싱글 사인온으로 그 personal authentication으로 만들겠습니다.
Ya, terima kasih.
네, 이상입니다.
Baik, terima kasih banyak sekali lagi kepada Pak Yon dan Misteri atas waktu dan kesediaannya untuk menjadi pemateri kita. Jadi mungkin untuk sesi 1 ini kita sudahi. Jadi dari tadi pemaparan terdapat beberapa poin yang bisa saya ambil. Yang pertama, jadi transformasi digital dan energi secara serius saat ini telah dilakukan di berbagai negara besar seperti USA, Europe, dan China, khususnya pada bidang infrastruktur digital dan green economic growth. Dan di Korea sendiri fokus pada data, network, dan EA, sehingga menciptakan lapangan pekerjaan baru dan peluang yang lebih luas. Digital New Deal ini mencakup 4 komponen. Yang pertama, penguatan ekosistem berbasis data network dan AI. Yang kedua, transformasi digital pada infrastruktur pendidikan online. Yang ketiga, pembinaan the unchecked industry. Dan yang keempat, digitalisasi sosial overhead capital. Selanjutnya tadi dari materi yang kedua dapat kita ambil beberapa poin, yaitu jadi mindset public service ini adalah wujud kehadiran pemerintah di keseharian masyarakat. Jadi di mana layanan publik perlu ditingkatkan dan menjadi prioritas nasional melalui upaya pembangunan arsitektur SPBE untuk menghadirkan super apps, yaitu layanan terpadu dan terintegrasi. Dan untuk arsitektur SPBE ini mencakup 7 domain. Yang pertama, proses bisnis, layanan, manajemen tata kelola, data dan informasi, aplikasi, infrastruktur, dan keamanan. Baik, mungkin untuk sesi 1 ini kita sudahi. Terima kasih sekali lagi Pak Ion dan Misteri.
Terima kasih, thank you Misteri.
Baik, selanjutnya kita akan masuk kepada sesi kedua. Bapak Ibu yang kami hormati, kita akan mendengarkan 2 paparan pada sesi kedua ini. Pada sesi 2 ini kita mengangkat tema efforts to overcome the pandemic using ICT. Langsung saja pada materi pertama, kita akan mendengar materi Governance for Disaster Risk Management in Korea, focusing on COVID-19, yang akan dipaparkan oleh Mr. Lee Han-kyung selaku Deputy Minister of Disaster Management Coordination of BISMOIS. Kepada Mr. Lee Han-kyung kami persilakan.
Mungkin bisa langsung disampaikan video dari Mr. Lee Han-kyung.
Hmm, Mbak Bunga,
Iya, Mbak.
iya, ini masih ada kendala dengan videonya. Apakah tidak masalah untuk kita mendengarkan paparan selanjutnya dulu, nanti baru kembali ke videonya?
Oh, jadi baiklah. Kalau gitu dari eh, Ibu Dewi dulu ya berarti.
Iya, bagaimana? Apa tidak masalah, Mbak Bunga?
Coba sebentar ya, Mbak.
Iya.
Sudah disampaikan ke pihak Korea, mungkin bisa dilanjutkan, Mbak.
Iya, nggak apa-apa ya Mbak Bunga ya. Oke, baik. Mungkin untuk selanjutnya kita akan mendengarkan paparan dari Ibu Dewi Nur Aisyah terlebih dahulu. Kita akan mendengar materi ini dengan judul The Use of ICT for COVID-19 Pandemic Control in Indonesia. Kepada Ibu Dewi Nur Aisyah dari Kementerian Kesehatan, kami persilakan.
Baik, terima kasih banyak Mbak Mutia. Let me share my screen first. Hi, good afternoon, everyone. Thank you very much that I have this opportunity. And this afternoon, I would like to provide some brief descriptions about the use of ICT, or Information Communication and Technology, for COVID-19 pandemic control in Indonesia. Okay, so we knew that technology have been used a lot during the COVID-19 pandemic. It has been used for digital diagnostic and genomics, for computer vision, for smartphone applications, telemedicine, and then for the syndromic surveillance, and then for mobility pattern tracking, and so on. We believe that technology play a pivotal role in handling the COVID-19 pandemic across the globe. We believe that the data is a vital component in helping the government battling with COVID-19 pandemic. By having a robust data, we can have a better understanding about the current situations, about how the pandemic is evolving, how the pandemic has already spread across the country, what are the risk factors, what kind of strategy implementation that need to be done and to be developed in order to minimize the fatality. So, in the perspective of public health, we believe that there is a need, a very huge need for robust data and implementations of a very good ICT in every country. It can provide insight into preventive and promotive action. We can evaluate the spread of the diseases. We can build resilience of the people as well as the system to cope with the virus. We can build the community awareness. We also can limit the population movement. We can set up health protocols and guidelines for every sector. We also can allocate scarce resources effectively. And the most important thing is we can help the policymakers to respond more efficiently. So at the beginning of pandemic, I have been recruited and involved in the COVID-19 National Task Force since March 2020. So the first case of COVID-19 was found in Indonesia on March 2020. Right away on 16th of March, the president initiated to have a COVID-19 National Task Force. And I have been working there since March 2020 up to today. The first assignment I have is to develop an integrated information system that can help to see how the COVID-19 pandemic evolved in Indonesia. So at the COVID-19 National Task Force, we developed what we called Bersatu Lawan COVID, or United Against COVID, or we call it just BLC, as one data for COVID-19 in Indonesia. We use the big data integrations, we use machine learning for predictive measure, we collect the data on real-time basis, we did an advanced data analysis as well as provide updated information for public. So what does BLC do? BLC collected the data and integrated the data not only from the health sector, but also from non-health sector. We integrate the data from the Ministry of Health, starting with the laboratory, data from the hospitals. We can evaluate how the BOR or bed occupancy rate at the hospitals. Do we need to add more beds to ensure all of the sick people can be treated right away at the hospitals? We also collected the data from the district health offices to evaluate about the epidemiological investigations to see how the contact tracing has been done, or how about the spread of the diseases at a specific cluster. We also integrate the data because the treatment of the COVID-19 does not only happen in hospital, but also at emergency hospital and quarantine centers. For those who are asymptomatic or have very mild symptoms, they will be quarantined at the quarantine centers. And we have, I think, more than 10,000 in Indonesia. So we also collected the data on the emergency hospital and quarantine center, as well as monitoring the people mobility who are using trains and airplanes in Indonesia. The most important part that the COVID-19 National Task Force do is have a information system to monitor the health protocol compliance across Indonesia. And I think this is the first system that have been developed using in a very big country, collecting the data every day to monitor health protocol compliance with coordination across sectors. I will explain it to you later in more detail. The second one, if you know, in Indonesia on February 2021, the president instructed us to have a micro PPKM. It's kind of limited the population's mobility in the specific area until micro level. Let's say we have provinces, we have district and cities, we have sub-district, we have villages level. So the micro PPKM will be implemented up to village level. We also evaluate how does the PPKM have been done in several places, and how is the evaluation of the performance of the posts that are doing the micro PPKM. The last one, considering the opening of the educations at schools, we also monitor the compliance of health protocols at education sector. So you can see at this graphic that we collected the data. It's not alone. We work together across institutions, across sector, with the health sector, with the Ministry of Internal Affairs, with the military officers, with the police officers as well, because it can't be done alone. A COVID-19 pandemic needs to be handled together. I forgot to mention one thing. In order to strengthening the data and IT infrastructure, on September 2020, we developed a big data analytics capacity, considering, let's say, 270 million of people in Indonesia. We need to provide and strengthen the infrastructure. So we have a big data analytic capacity who can provide the query of 25 million data within 1 millisecond. So that's what we've done. And this is the COVID-19 weekly data analysis. It can be accessed through the COVID-19 public website, www.covid19.go.id. So the community, society can access and see how does the pandemic evolve, as well as to monitor the compliance of health protocols happening across the country. So this is one of the things, the use of ICT during the pandemic of COVID-19 in Indonesia. As you can see, Indonesia built the first health protocol compliance monitoring system that utilized more than 541,000 of police officers, military staff, and behavior change ambassador. What are they doing? They are evaluating the implementations of health protocols among community in public places, in mall, in worship area, the tourism area, at schools, at the offices, all of the public space, places, they evaluate the implementations of health protocol. So currently we have been monitored more than 764 million of people in Indonesia across 514 districts or cities across 34 provinces in Indonesia. Within one day, we received the report of the monitoring the compliance of health protocols, around 600,000 up to 1 million reports every day. So you can see in here, this is the points where the offices are located, where the cases are located. We extrapolate the data to ensure the justicial operations is conducted at the specific appropriate places that need to be considered have a very high number of cases. So as you can see, this is the dashboard. Let's say at the left-hand corner, we can see that there are 43 million of reports that we collected in the last 3 months. What you will see, every green points reflected where are the place of the reportings come up. This is real-time reporting system. They report what's happening in there, how the compliance of health protocols, and it can be validated using the pictures. The second one, we also know the yellow point shows who is the identity of the personnel who send the reports and where they are. So let's say in these cases, we can see this is the person who sent the data, where are they? And it can collect so many activities with various tasks and assignment, POSCO establishment, POSCO performance, logistic, justicia, operations, and so on. So in developing the system, we utilize two change of command from the military officers. Let's say from Kodam, Korem, Kodim, Koramil in Indonesia. Let's say that's from started with the national level to provincial level to district and cities level, considering a very huge number of people and areas in Indonesia. We built the change command according with the, we call it TNI, or military, Indonesia National Military Offices. And then the second one is the police officers. It's the same. It starts with the national level, provincial level, and then district and cities level, as well as sub-district level. And in the perspective of the Ministry of Internal Affairs, we will include the data from the provincial, district, and cities, sub-districts until the villages. So the monitoring evaluation dashboard is provided across all levels, so they can evaluate how are their officers working. Do they report every time? How are they working? How are their performance? It can be monitored using the analytical dashboard. And the registration of the personnel, it is assigned to the field of is handled by the respective unit. And you can see in here, up to today, we have been collected more than 1.6 million of reports from a billion, this billion of report from the officers at the field, with more than, I think, 1,000 assignment. So this is the flow, how we use the ICT, one of the example highlighting the promotive and preventive measures. The first one, we developed the monitoring compliance, the compliance of health protocols using the individual and institutional compliance level using the BLC apps. And then the Polari TCO operations also included. The third one, we also have behavior change program. So at the COVID-19 National Task Force, there is a department specifically handling the behavior change program. What did they do? They involving a lot of people who are really close with the community. Let's say the key opinion leader at the society, a religious leader, they engage all of them to be included as the behavior change ambassador. They went, let's say, to the village leaders, explaining why we need to do the hand washing, wearing masks, let's say, and physical distancing. How is this important? How to minimize the risk and fatality? So behavior change program, also the data collection were done using BLC as well. And the fourth one, it also used to be implemented during the elections to monitor the compliance during the district or region election that has been done in Indonesia. So at the end of December 2020, there is a massive elections happening across more than 200 districts and cities, and it is in the middle of pandemic. When it is decided that the elections still need to go on, then we need to ensure the compliance of health protocols is still going on there. So instead of not only they are having the elections, but we also ensure that the health protocols is still doing well during the elections. And the fifth one, since the February 2021, the president instructed us to have a micro PPKM, the limited mobilizations and activities of the society. We also have these tools to monitor and evaluate how the micro PPKM happened across Indonesia. It covers all of these villages across Indonesia. We also developed the BLC for monitoring compliance in public facilities to monitor the compliance at education sector. So by having the micro PPKM, we learned a lot that having the data in a very specific smaller unit will provide us in more detailed data and show us more concentrations about what's happening there. So you can see in here, this is the evaluations about how the health protocol compliance happened across 514 districts and cities in Indonesia. You can see the red one. It implies that the compliance below 60%, and we thought it has to be more than that. For the orange one, the compliance is between 61 up to 75%. The good one is the green one with the compliance above 90%. So when we look at city and district level, this is the first one that we had on September 2020 before the micro PPKM has been rolled out. You can see in here, let's say this is Jakarta, the capital city of Indonesia, this one. So you can see in here, oh, it looks like that's fine. It's only 2 districts or cities are having compliance between 61 and 75%. When we have a micro PPKM, the level of analysis can go down up to sub-district level, and we can see, oh no, the yellow one, not all of them are yellow. We can see some of them are oranges, and even though, and we can also see some of them also red. When we have the analytics level up to the village level, you can see in here, it's more specific. We know which villages has a compliance less or better one. And we can see in here, although this is a yellow, you can see in here, some of them are red, some of them are yellows and oranges and green. So this is the kind of analysis that we had after using a micro PPKM. We can evaluate the health protocol compliance up to the village level. It also has been submitted into appeared international journals because it's one of the interesting use of information technologies that used for during pandemic in promotive and preventive actions, and involving a lot of sectors, including the military office, police officers, as well as the community as well from the behavior change ambassador. We also can see which villages have not sent a report to the system. So it can be, look, if you see some of them are white, it means that there are no reports there. So we can evaluate who has sent the report, who have not sent the report. So we can evaluate how the performance of the officers at the field, do they really conducted their assignment to monitor the health protocol compliance or not? So this is one of the example, the use of ICT during pandemic in Indonesia, and it is highlight the importance of a promotive and preventive action before somebody get infected. So I told you about the micro PPKM. So up to 20th of February, we have collected the data of the micro PPKM performance. It has been more than 151 million of activities carried out across Indonesia. We can see what are they doing. You can see in here. Most of them, let's say, they are distributing masks. They educate people about the importance of wearing masks, about physical distancing. They also disband any crowded, and then they also have disciplinary actions for those who did not obey the regulations of 3M. We call it 3M for wearing masks, hand washings, and physical distancing. So we can evaluate the performance of all of provinces in Indonesia. And the unique things of this, the report does not only send using text, but we also can see the photo, the pictures of the areas that have been monitored by the officers. And it is real time. It is collected real time. And you can see in here, this is the condition of a market in Bali, how the airport in West Nusa Tenggara, how a condition in office in Central Java, a station in West Java, a tourism destination in Yogyakarta, and a restaurant in Aceh. So we can see more closely to the society and look at this. Some of the people are not wearing masks, let's say. We can see at some places let's say at the station, we can see the officer work really hard and they did very well. And this is the example of the monitoring of health protocol compliance during the regional election. You can see in here how they need to have a distance between from one to another, and then they are using hand glove as well. So this is the real examples of how we use the ICT for promotive preventive action as well during the election. So the election is still going on, and we also conclude that it does not affect the increasing number of cases of COVID-19 pandemic after that. Okay, the other thing that we have done is we also analyze the population's mobility monitoring system to evaluate the mobility, the density, the migration pattern, and to explore the impact of mobility to COVID-19 cases. So we also monitor how the people are going from one places to another. And like now we knew about the Omicron, how about people going from one places to another? It can spread the disease quickly. And the use of data and IT as well for public communication. So you can see in here, we use the data, we use the analytics data for disseminations of COVID-19 analysis and information for public through various media channels, as well as the hoaxbuster. So in Indonesia, we'll still find some news that are not true, and it is misinformations among the community. So the Ministry of Information, they also have a hoaxbuster to eliminate any misinformations in the community. Okay. I have been talking a lot about what we have done in COVID-19 National Task Force. So currently, I have been recruited to work on the DTO, or Digital Transformation Office at the Ministry of Health. And you also can see how the pandemic taught us a very good lesson, the needs of using very good technology, how we need to have an interoperability across system, and the developments are going on. So we can see in here, this is the Ministry of Health, what have been done so far. So they also have the ICT used for testing, tracing, treatment, and the vaccination strategy. So in terms of testing, they already collected the data, integrate the data from the PCR test and the antigen test system, as well as integrate the whole genome sequencing result into the system. So they will know how are the results in real time and integrate it into the tracing. Once someone has been confirmed positive, it will be detected at the contact tracing app, and the surveillance officer can trace and have an epidemiological investigations activities at the community. The other things that we done also for the Peduli Lindungi. The other thing that have been developed for controlling the pandemic is using Peduli Lindungi, and currently being used to evaluate somebody who have been vaccinated, first dose or second dose or even booster. And the third one is about their confirmed positive status. If someone is positive and they want to go to mall, they screen the apps, it will go black. It means that he is somebody who are positive or a close contact of somebody who are positive. So they could not enter a public places. It includes mall, it includes schools, it includes airport stations and other public places as well. So the Peduli Lindungi have been used for us to access our vaccine certificate, as well as for us to prove that, okay, I have been vaccinated, second dose, I'm fine, and what types of vaccinations also recorded there. The third one, the ICT also have been used in the treatment aspect. What we have done, we have a self-isolation telemedicine apps for somebody who have been detected positive at the testing system. It will be automatically send WhatsApp messages to somebody who are confirmed positive. Hi, you have been confirmed positive. Don't worry. You can contact the doctor using telemedicine, and it's free. And you can also have some medications according to your symptoms. It's also free for the people who have been confirmed positive. So we have that. And the second one, we also have Siranap. Siranap means if somebody have been confirmed positive, they would like to know, where can I go to hospital? Which hospital have a bed available, so I can go there and I can be treated there. So we have Siranap. It has been version 3. It has been improved, so we can know almost real time about the bed availability at the hospital. So somebody especially during the second wave. I need to admit that the condition of the hospital is very exhausted. It's very full, but now it's relatively still controllable because, you know, the symptoms of the Omicron kind of less likely to be more severe. So yes, we can access and know how about the bed availability for people who needs the treatment for COVID-19 using the Siranap. And I think the last one about the vaccinations, we have vaccine recipient system, we have a vaccine data entry system, and we also have a vaccine logistics system. So we know how many per people in Indonesia need to get vaccinated, how it will be distributed. Somebody who already got vaccinations will have can download their vaccine certificate as well. And it can be used for other purposes, like I have already mentioned, using Peduli Lindungi apps. So now I think more than 200,000 samples has been registered to testing system every day. So our everyday testing number is around 200,000. And I think the 1.5 million of new people or user are registered to the vaccine system every day. So this is I think the rate, the speed of our vaccinations about 1 day is for 1.5 million of people. And then I think for the tracing and tracking app, Peduli Lindungi, the user access is around 8 million for 1 day. And now up to 24 February, we have 92 million of people who have been registered to Peduli Lindungi apps. It will help us to know about the tracing and tracking and fencing as well. And I think the daily active users currently around 8 million of people. I know we still have a lot of more homework in Indonesia, considering the huge archipelago. Not all of them have a very good understanding about the technology. And that's why we need to work together to ensure how technology can help us more on handling the COVID-19 pandemic. So the Ministry of Health has already realized the importance of health transformations. The pandemic has already awakened the importance of health sector resilience, and Indonesia's health system is ready to transform. So the next things we need to learn is collaborations is needed for a healthy Indonesia. So understanding that, the Minister of Health developed a digital information office who have three pillars of objective: to reporting, process efficiency, to support data analysis and decision making, to have a health digital ecosystem collaborations, to increase the digital capacity and the human resource capacity and capability. So that's what we'll do. And the future, it will digitizing all of the health sector since in the womb until critical. So this is a continuum of care since a baby has been born, what kind of the health services that he or she need to be done, and so on. It will be help using the technology use. So this is the health technology transformation areas that will happen starting from now up to let's say next few years later, about integrations of development and health data system. In Indonesia, there are a lot of applications exist and they do not talk to each other. The interoperability is one of the things that need to be done in here. We need to integrate and develop a healthcare application system, as well as how to have an efficient health services at the puskesmas, we call it, or the public health center, at clinic, at hospital, laboratory, and dispensary. And the outcome, we also would like to have a very strong collaborations and digital health ecosystem that involving not only the government, but also the industry, the private and the public sector. So at the end of December 2021, the Minister of Health has already declared about the blueprint of digital health transformation strategy up to 2024. This is where we are going on starting from COVID-19. We also will have digital health transformations in health sector in Indonesia. Okay, I think this is the last slide for me. I believe that the number react to our responses, and I believe the power is in our hands, and some of that power is in your pen, in your keyboards, and in your words. Thank you very much for listening. Come back to the moderator, Mbak Mutia. Thank you very much.
Ya, terima kasih banyak Ibu Dewi atas waktu dan pemaparannya. Mungkin ini dikarenakan Ibu Dewi sendiri tidak bisa mengikuti sampai selesai ya Ibu ya. Mungkin kita bisa ada beberapa pertanyaan ini untuk Ibu Dewi di kolom chat. Mungkin Mbak Desti bisa langsung dipaparkan. Ya, ini pertanyaan dari Pak Gayu dari Kemenpan. Terkait dengan aplikasi Peduli Lindungi bisa monitoring tempat di mana saja yang pernah dikunjungi oleh individu. Apakah rekan-rekan dari Kemenkes akan memanfaatkan informasi ini? Jadi untuk apa informasi ini?
Baik, thanks Mbak Mutia. So the first question is from Pak Gayu from Kemenpan RB about how the staff at the Ministry of Health will utilize the data from the Peduli Lindungi. Peduli Lindungi record how many visits have been done from the across Indonesians people who are using the app. When we would like to visit some public places, let's say to the mall, to the tourism destination, to the airport, we need to scan a barcode, a QR code, and the QR code will identify us. Do we have a green line? It means we have been vaccinated and having second dose. And then the yellow line is for them who have the first dose of vaccinations. And we also have a red one, which implies that the person who would like to visit the public places has not been vaccinated at all. And the last one is the black one. It indicates the people are confirmed positive of COVID-19 or a close contact of person who are confirmed positive. So the Minister of Health has just requested me to develop an analytical dashboard for Peduli Lindungi. And I do believe Peduli Lindungi can help us a lot in identifying. The first one I look at the data analytics is about how many visits have been done across the provinces, across the district and cities, and when they visit, in which type of public places are more likely to get visited. Let's say for now, I think most of them are using at mall. It has a very high number of visitors. And let's say the second one is about an airport and a restaurant as well. And then after I know which places is most likely visited by the Indonesian people, the next one, how is the result of the scanning? So I know which one or which places have a very high number of persons who are positive, but they still went to that public places. So I know which in which mall, I know what name of the mall as well. So what will we do with the data? The data will need to be coordinated, let's say, with the local staff at the specific places, and to make them more aware about the scanning, how the importance of screening, how we can ensure the safety of the people who visit the public places and separate them with the people who might spread the diseases. So that's one of the things that also we have been done, but I think it's still in the process. We just completed the dashboard analytics, but the next one to do is having a coordinations with relevant partner and institutions about the result of that. The next one, we need also to improve the use of the analytical dashboard. Not only can be seen at the ministerial level, but it also can be seen at the specific places of public places. So they know how many people went, how many people screened, and how are they status. I think that's what I can say, Mbak Mutia. Thank you very much.
Terima kasih banyak Ibu. Untuk pertanyaan selanjutnya Mbak Desti, mungkin bisa Mbak Desti. Ini untuk pertanyaan kedua mungkin ada dari Mr. Orbeus Chong Rujon. I would like to know how the data collected through Peduli Lindungi is analyzed.
Yes, so we have individual data of Peduli Lindungi applications. Currently, we are using it for a vaccination certificate. That's the first one. The second one, we analyze how the behavior of people, of Indonesian people, to go to the public places. And the third one, and it's currently under development, is really about the tracking. At the beginning of pandemic, Peduli Lindungi is used for a tracking, but I think the algorithm needs to be improved so the analytical result can provide more valuable interventions or strategy. So I think the first one for the vaccination certificate, the second one to see the behavior of Indonesian people who visit the public places. Are they categorized as red, yellow, or green, or black? And the last one, we also would like to have these applications for tracking. I think we can track somebody who used the Peduli Lindungi apps for the past 14 days, but that's for the sake of the tracing. It's not for everyone. So let's say we confirm somebody positive, and then we look at where did he go for the past 14 days. That's what we are currently doing using the Peduli Lindungi applications. And I think it also integrated with the isolation telemedicine as well, because somebody who have been confirmed positive, and then the result will come up at Peduli Lindungi. You can see what's your PCR test result at Peduli Lindungi, and then the next one, if you confirm positive, it will be integrated as well into the isolations for telemedicine. Somebody who need to quarantine themselves, and then having the telemedicine facilities as well as the medications. So I think that's what we have done using the Peduli Lindungi.
Oke, terima kasih Bu Dewi. Mungkin ini ada pertanyaan terakhir dari Mr. or Miss Dong Hyun Kim. Yeah, I guess Peduli Lindungi will be able to take a role of vaccine passport. Do you have any idea or plan to link the app to other countries' similar app which show vaccine certificate, like COV in South Korea?
Okay, thanks for the question. So yes, we do. So considering the G20 will be conducted in Indonesia as well, the Minister of Health has already instructed the team at DTO. So Peduli Lindungi COVID-19 matters, it is taken care of by the tribe. We call it Health Security Tribe. So it's not my tribe. I'm under Primary Care Tribe. So there's another tribe which is handling the health security. They have already successfully integrated the vaccine passport, let's say the vaccine identification for other countries other than Indonesia. But I need to check how many countries have been successfully integrated. I think it's in Asia as well, but I need to check about South Korea. But I agree, we already have about that one. And it has been going on. I think at the beginning, we already integrated 10 countries who also can have a vaccine passport. Let's say they have been vaccinated outside the country. They went to Indonesia, and Indonesia can acknowledge their vaccine status as well. Yes, I agree for that one. We're already on it. I think it has been started, successfully implemented for 10 countries, and it will be at more number of countries, especially when we would like to move on onto G20 event. So yes, thanks Mr. Dong-Yun about that one.
Oke, baik, mungkin karena keterbatasan waktu, mungkin untuk sesi diskusi ini bisa kita cukupkan. Terima kasih banyak atas waktu dan pemaparannya Ibu Dewi. Mungkin kita bisa lanjut ke materi yang selanjutnya. Materi selanjutnya ini tentang governance for disaster risk management in Korea, focusing on COVID-19. Yang akan dipaparkan oleh Deputy Minister of Disaster Management Coordination Office, MOIS, Mr. Han Kyung. Kepada Mr. Han Kyung, kami persilakan.
Hello everyone, it's my pleasure to meet you. I hope you and your country win the war against the threatening enemy, COVID-19. My name is Lee Han-kyung, Director General of Social Disaster Response Policy Bureau, the Ministry of the Interior and Safety, Korea. This is my first time to give you a lecture. Today I would like to talk about disaster response governance in Korea. I hope that we could build and maintain long-lasting relationships by taking this as an opportunity. This lecture focuses on governance for disaster risk management in Korea around COVID-19. Amid this fatal national disaster, we look through the way how the Korea government respond to COVID-19 by focusing on CDSCH. Especially the audience can build an understanding of critical factors in order to handle with a disaster crisis quickly with digital technologies as well as reliable infrastructures, regularly and physically. This course can be of great help in preventing and managing the disaster. The course mainly consists of disaster response system in Korea, roles and responsibilities of Central Disaster and Safety Countermeasure Headquarters, infrastructure to help Korea respond to COVID-19, and measures to respond to COVID-19 using digital technologies. The course aims to build an understanding of governance to manage the disaster risk effectively, figure out which infrastructures are fundamental to support for prevention and response to the national disaster, and understand how Korea utilizes digital technologies to cope with the disaster. Let's take a look at the map. As you can see, COVID-19 swept through the world. People in every part of the world are doing their best to fight against the virus, but there is a long way to go. We could say that the entire human race is fighting the World War III. As we work for the government, we all should serve as soldiers to defeat COVID-19 and take back the green earth. Korea's disaster response system varies slightly depending on the type of disaster. Then let's find out about Korea's COVID-19 response system that is currently in operation. With regard to response to COVID-19, the Prime Minister serves as the head of the Central Headquarters, CDSCH. This implies many advantages. I will explain the details later. The Ministry of Health and Welfare is in charge of the prevention and control of infectious disease as CDMH. Korea Centers for Disease Control and Prevention, KCDC, is in charge of the Quarantine Headquarters, CDCH. Ministry of the Interior and Safety that I work for installs a pan-governmental support group along with related agencies of the central government to assist the activities of CDMH. Local government plays an important role as they provide services to nearby citizens in need. They install local disaster and safety countermeasure units in their region to carry out disease control activities on site. That is how the COVID-19 response governance framework of the Korean government is structured. In a nutshell, the framework enables all administrative agencies across the country to cooperate together to act as a single organization led by the Prime Minister. Like an army, all units are systematically organized to defeat and respond to the disease effectively. The risk alert level system stays on attention at the outbreak of COVID-19 in China. NKCDC immediately begins to operate response team, monitors risk symptoms while maintaining its response capacity. When the outbreak of disease is detected in Korea, the alert level is elevated to caution. KCDC installs and operates CDCH disinfect at the site and initiate the infrastructure to control the disease. When restrictive transmission of the disease is detected, the alert level is upgraded to alert. Ministry of Health and Welfare and corresponding local government install and operate CDMH and LDSCH local headquarters respectively. If it is expected that the situation will get worse after detecting risky symptoms, Ministry of the Interior and Safety begins to operate PCSH. If the disease spreads to local communities or across the country, the operation of CDSCH central headquarters is initiated. As you can see, the Korean government implements a strategy to expand its response structure according to the risk alert level. The government operates the response structure depending on the scope and severity of the risk. From now on, we will explore the specific roles of each agency in the response system. The first major agency to look at is CDCS or KCDC. It has expertise and plays a key role in dealing with infectious disease. There are three main roles of KCDC. supervision of infectious disease prevention and control activities, infectious disease monitoring system operation, and public relations. With regard to the supervision of infectious disease prevention and control, KCD shares the information of confirmed cases, support the supplies required to prevent and control the disease, and operate the risk assessment meeting and expert council. As for infectious disease monitoring system operation, KCDC operates rapid response team at site, conduct epidemiological investigations, and manages the patient and those having contact with them. Communicating with the public is also a critical role of KCDC. As proactive support of the public is the key to successful prevention and control of the disease. CDMH generally oversees the situation on the control and management of infectious disease risk. Among the functions of Ministry of Health and Welfare, KCDC has been established and placed under each wing to manage infectious disease. Therefore, Ministry of Health and Welfare support KCDC to carry out related activities. Also, Ministry of Health and Welfare issues the National Infectious Disease Risk Alert, mobilize and allocate hospitals and medical personnel. Local government are field players that carry out activities to prevent and control the disease at site. They conduct epidemiological investigations with the support from the central government, operate temporary treatment centers and temporary residential facilities, manage people under quarantine, and transport and support the patient, etc. In fact, the creative and active role of local government determine the success or failure of national defense. A good example is the drive-through testing created by local government. A massive disaster like COVID-19 is hard to overcome only with capabilities of disease control authorities. The Ministry of the Interior and Safety, where I work, plays a role in supporting response capabilities of local governments by helping them and working together with a number of central ministries. In a word, it serves as a facilitator of great governance. In addition, it is responsible for multi-ministerial participation projects that are difficult for quarantine authorities to handle. Examples include the operation of quarantine facilities and temporary treatment centers. Central Headquarters meeting is a unique governance framework that is found only in Korea. It is a nationwide meeting group presided by the Prime Minister in charge of each administrative department and agency, with the attendance of every central agency, metropolitan, province, city, district. Holding such a meeting was possible as the country is connected with high-speed communication networks. In the Central Headquarters meeting, the participants deal with major policies of the central government as well as detailed items on site on COVID-19. Critical issues nationwide are discussed. Representatives of related ministries provide alternatives. Discussions are made and determined in final. We can witness the well-organized governance framework consists of the central government and local government and how it works vividly each day in Korea. Korea has experienced numerous natural social disasters, and the country has established the legal infrastructure during the process of overcoming such crises. First, the country enacted Framework Act on the Management of Disaster and Safety as its basic framework and tool for effective disaster management. Infectious Disease Control and Prevention Act is established based on lessons learned from MERS in 2015. Compared to other countries, we do not have enough number of doctors or nurses to respond to COVID-19. However, the government worked hard to reduce the burden on them through the governance providing a series of measures. Military personnel is a peculiar type of human resources existing in Korea. There are doctors and nurses among the military personnel, and they also conduct a critical role to provide medical services in need, if there are insufficient number of medical staff. Also, administrative staff of government conduct a critical role to manage temporary treatment centers and those under self-quarantine and inspect high-risk facilities. With regard to physical infrastructure, we have quite a large number of hospital beds. However, we have installed and operated temporary treatment centers to separate them from ordinary treatment and healthcare services for other patients. Screening stations have evolved from conventional concept to various models such as drive-through, walk-through, etc. There are three requirements to establish and operate an effective governance framework to respond to COVID-19. First, we need matured citizenship that cares for the safety of me and my family as well as our neighbors. Koreans have a strong bond or a sense of unity on earth, originated from the experience of overcoming numerous adversities. Such matured citizenship can be found from owners of singing rooms who voluntarily decide to suspend their business, or people who increase or support Koreans entering from countries with many confirmed cases. Second, we do not have many doctors or nurses, but they dedicated themselves regardless of their field of specialization to overcome the crisis that came from rapid increase of confirmed cases. Citizens launched a thank you challenge by the social media to pay gratitude to them. The picture below shows the meaning of comforting and encouraging each other. Third, the Prime Minister and almost all government employees are working on weekend to fight against COVID-19, although it is not their main areas of work. It would not be possible with a sense of responsibility working for the public. I believe that citizens and healthcare workers and government employees are all heroes and heroines in our society. Surveillance, testing, tracing, treatment, and quarantine are key elements of the Korean quarantine system. First, we focused on prompt identification of confirmed cases. When we find any confirmed cases, we analyze the chain of transmission and source of infection and take actions to stop the spread of the disease based on the information gathered. Those who are confirmed with COVID-19 are isolated in temporary treatment centers to receive medical treatment, and people having contact with them are isolated or undergo active monitoring depending on the severity of symptoms. We are providing public guidelines to follow as an individual or as a collective group, and local government conduct education and promotional activities to reinforce responsive capabilities of their communities. The COVID-19 response process in Korea is not greatly different from that of other countries. However, Korea tries to carry out this process more quickly and actively. Korea has established a solid and concrete governance structure to respond to COVID-19 and implemented various measures based on the framework. As for the government, Ministry of the Interior and Safety serves the role of governance facilitator. Ministry of the Interior and Safety installs and operates pan-governmental countermeasure support headquarters to provide administrative support in need so that related agencies promptly cooperate and deploy its personnel at site to assist activities related to COVID-19 response. For instance, Ministry of the Interior and Safety deployed a pan-governmental unit to Daegu. When the city and nearby regions were witnessing an increasing number of confirmed cases in order to support and provide special measures. During the process, the Prime Minister led the unit directly to solve problems on site. In addition, Ministry of the Interior and Safety is carrying out various activities, including the operation of temporary treatment centers and temporary residential facilities, management of people under self-quarantine, and blind spot inspections. From now on, I will take some examples of what Ministry of the Interior and Safety has done as a governance facilitator. Operation of temporary treatment center is one of the main activities of Ministry of the Interior and Safety. The decision to install and operate temporary treatment centers was made as more than 2,000 patients had to stay at home due to a lack of hospital bed, with a rapid increase of confirmed cases in Daegu and nearby areas. We had to find an alternative urgently. At that time, cases in China provided an important clue. It confirmed that approximately 80% of patients had mild symptoms and they did not require hospitalization. As more temporary treatment centers were installed and operated, all patients staying at home were transported to quarantine locations and hospitals were able to conduct their business as usual. Likewise, the installation of temporary treatment centers was not come from a thorough plan. Rather, it was based on an urgent decision to find places to admit a rapidly increasing number of patients. However, Ministry of the Interior and Safety was able to run the centers without biggest obstacles by using cooperative relations with other ministries and local government. It was a great governance. I will briefly explain to you about the operation of temporary treatment centers by looking at the pictures. Before we move on to discuss about the complex process and details, first, the government secured facilities to install the temporary treatment centers. Those facilities include both public building and those from private sector. Samsung provided this. There are a lot of works to prepare for the operation of temporary treatment centers, as they have to switch their functions to how to such facilities are built for in the first place. The process of operating temporary treatment centers should be precise and thorough, as we have to ensure the comfort of individuals during their stay and take measures according to their changing symptoms. Medical staff and administrative support staff frequently discuss with each other and seek ways for successful operation of temporary treatment center. It is true that people enter the temporary treatment center with a heavy heart. Operating staff and medical workers feel fulfilled to see those admitted to the center are recovered from the disease and return home with a smile. Temporary treatment center operating group, jointly led by Ministry of the Interior and Safety and Ministry of Health and Welfare, consists of 5 teams with the participation of 7 government agencies. There are more members working for the operating group than usual, as the centers are installed out of urgency. Doctors and nurses are responsible for providing medical treatment to the patient, along with the Ministry of Health and Welfare. Medical staff and waste treatment are mostly handled by the private sector. The main objective of the operating unit is to help the patient stay comfortably in the center, recover from the disease, and return home. Well, let me briefly explain about the operating guidelines of temporary treatment centers in Korea, as you may operate your own in your country. We recommend you consider regional distribution of temporary treatment centers based on the population size, if possible. In the case of Korea, public facilities of central local government were the most ideal destination for temporary treatment centers to secure such facilities promptly. If you have no experience of operating such center, it would be better for the central government and agencies in charge of healthcare in particular to take the lead for stable operation. However, allowing local government to participate in the operation and gradually shifting the role to them can be a way for efficient operation of multiple centers. We also recommend you utilize local medical talents where such center is installed if possible. Lastly, an agency playing a role similar to that of KCDC should provide operating guidelines on temporary treatment center in order to increase the efficiency and guarantee stable operation. Make sure that all operating and medical personnel should work in a shift after serving for certain hours to operate such facilities for a long time. Daegu faced the most dangerous situation in Korea, as the city had more than 6,000 confirmed cases in a short period of time. About 45% of them admitted to temporary treatment centers. This meant that temporary treatment centers played a critical role to prevent the collapse of medical system in Daegu and Gyeongbuk region. I assure you that the case in Daegu can be a reference example if your country faces a similar situation. In Korea, people suspected of infection are forced to stay in separate spaces at home for 14 days. Managing those under self-quarantine is one of the main duties of Ministry of the Interior and Safety regarding COVID-19 response. When self-quarantine of an individual is determined, local government assigns a case officer as manager, and the self-quarantine notice is sent to the person. The assigned officer continues to monitor the status of the individual on whether or not she complies with the guidelines. The self-quarantine order is released after 14 days if there is nothing significant to report. People under self-quarantine should install the self-quarantine safety protection app to monitor whether or not they comply with the guidelines. All foreign entrants are required to install the app, and Korean residents should install it with consent. This app sends an auto notice on the health condition of people under self-quarantine to the designated case officer. It also sends an alert if the person leaves the designated location. If fever or any abnormal symptoms are detected, the officer transports the person to hospital or take other actions for her safety. Now I will explain to you a series of responses using digital technologies. We use CBS to promptly spread the information on the outbreak of a disaster. If there are any confirmed cases of COVID-19, we send the message to nearby citizens promptly to help them not to visit places where people confirmed with the disease visited for having contact, and advise people who have already visited such places or contacted with COVID-19 patients to undergo testing for diagnosis or not to have contact with others. EDBS is designed to promptly provide the information on disaster to the public through TV with many viewers. The biggest advantage of EDBS is in that it can provide more information than CBS. Safety reporting allows people to report on items that may lead to a disaster to the government easily by using a mobile app. People can report behaviors or facilities violating the disease prevention control guidelines or suggest any policy ideas with regard to COVID-19 response. Disaster management is the key to saving lives. We all are fighting a war against COVID-19. We can conquer COVID-19 by cooperating together. Our hope is to take back the beautiful green earth. Thank you for listening.
Oke, baik. Terima kasih banyak atas pemaparannya dari Misteri Hankyung. Mungkin selanjutnya kita langsung saja kepada sesi tanya jawab. Mbak Desti, apakah ada pertanyaan Mbak Desti? Oke, baik. Oke, ini pertanyaan dari Mbak Bunga. Mungkin bisa langsung ditranslatekan saja Mbak Tia.
오케이. 그래서 지금 질문 하나 들어와 있는데요. 한국은 코로나 바이러스에 대한 바른 대응으로 잠시만요.
Yeah, you don't need to translate the question in English, so maybe I should answer in English. It would be much faster.
Oh, sure.
Thank you.
Sure.
So about the question on the screen, as mentioned in the previous presentation of both nations, data is the key to cope with COVID-19. And Korea has set up a legal basis for data collection and use to respond to pandemic prior to COVID-19 outbreak, fortunately. And Korean government has been investing a large amount of resources for open data policy. And as an outcome, matured open data ecosystem helped us a lot to create necessary services quickly through collaboration between public sector and private sector using the open data. And in addition, installation of high-speed broadband and mobile network throughout the whole nation and high distribution rate of smartphones and other digital devices played an important role to use digital technology as a major tool to help people in the time of pandemic. Thank you.
Thank you, Mr. Son.
Thank you, Mr. Son, for your answer. Oke, apakah ada pertanyaan lagi Bapak Ibu sekalian? Mungkin jika ada pertanyaan lagi bisa langsung raise hand saja. Oke, baik. Mungkin sepertinya tidak ada pertanyaan lagi. Oke, thank you so much, Mr. Son. I thought there's no question for the presentation. Oke, baik. Mungkin ini akhir dari sesi 2 kita. Jadi, Bapak Ibu yang kami hormati, setelah dari pemaparan kedua pemateri kita tadi, ada beberapa poin yang bisa kita ambil. Yang pertama adalah jadi pemanfaatkan teknologi digital dalam penanganan COVID-19 di Indonesia ini sangat membantu dalam memahami situasi terkini dan bagaimana menghadapi serta bagaimana pandemik itu berevolusi. Salah satu dari data yang dihasilkan oleh Kemenkes itu melalui integrasi big data untuk data yang lebih robust. Yang kedua adalah machine learning untuk membantu prediksi kasus yang akan datang. Lalu koleksi data yang real time untuk analisa yang akurat, serta analisis data yang advance untuk menghasilkan informasi terkini bagi masyarakat. Dan pada akhirnya pembangunan ekosistem teknologi digital sebagai respons terhadap pandemik menghasilkan transformasi digital di bidang kesehatan yang terintegrasi untuk meningkatkan layanan kesehatan bagi seluruh lapisan masyarakat. Oke, baik. Mungkin ini adalah kita sudah tiba di penghujung acara. Mungkin sebelum saya menutup, kita akan ada foto bersama. Mohon Bapak Ibu untuk dapat menghidupkan kamera. Mohon Mbak Tia atau Mbak Bunga bisa ditranslatekan.
네, 지금 사진 찍으려고 하니까 카메라 네, 다시 들어주시기 바랍니다.
Ya.
네, 카메라 켜주시기 바랍니다.
Baik, Mas Agi silakan untuk ambil fotonya, Mas Agi.
Baik, terima kasih kesempatannya. Mohon izin Bapak Ibu untuk mengaktifkan kamera sebentar akan kami screenshot sebagai dokumentasi. Terima kasih untuk yang pertama akan saya screenshot itu berada di slide pertama dari Zoom ini akan saya screenshot 1, 2, 3. Baik, terima kasih. Kemudian lanjut ke slide kedua. Ini kalau misalnya Bapak Ibu masih ada yang belum membuka kamera, akan bisa dibuka terlebih dahulu. Kemudian, oke, terima kasih. Kemudian akan saya screenshot 1, 2, 3. Baik, terima kasih Mbak Mutia, saya kembalikan.
Terima kasih banyak Mas Aji. Kami segenap tim pelaksana yang bertugas menyampaikan apresiasi dan terima kasih yang setinggi-tingginya kepada Bapak Ibu yang telah hadir secara daring melalui Zoom dan YouTube. Kami juga mengucapkan terima kasih kepada para pemateri dari tim Digital Government Cooperation Center (DGCC) dan dari pemerintah Korea, serta seluruh komponen yang terlibat yang tidak bisa saya sebutkan satu persatu. Semoga Tuhan Yang Maha Esa memberikan rahmat kepada kita dalam mewujudkan pembangunan negara Republik Indonesia yang lebih makmur dan sejahtera. Amin ya rabbal alamin. Kami mengucapkan permohonan maaf atas segala kekurangan dalam pelaksanaan kegiatan ini. Saya Mutia selaku MC undur diri. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Terima kasih Bapak semuanya. Thank you.